Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, period pain is common and a normal part of your menstrual cycle. Most women get it at some point in their lives. Now, it is usually felt as painful muscle cramps in the tummy, which can spread to the back and thighs. So, to discuss more on the menstrual pain, we have with us today Dr. Kalpana Chowdhury, Senior Consultant Gynecologist from Health City Hospital. So, not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Thank you so much, Dr. Kalpana, for joining to Good Life, the health show. So, today the topic which we have taken is, I'm sure the viewers who are watching our show must be knowing that this is a very common topic seen in female these days, or not these days must be, but this is a very common topic which is being discussed widely. Exactly. Now, if we want to know firstly about it, what do you exactly mean by period pain or the menstrual pain? What would you like to tell?
Well, during periods, we all know, like there is menstrual shedding. That means there is shedding of the uterine lining. Now, in that process, what happens? There is a hormone called prostaglandin, which causes contraction of the uterine muscles, and as a result, the girl will have pain. So this is called actually the period pain. In medically, the term is dysmenorrhea. We call it dysmenorrhea.
Dysmenorrhea.
Yeah, and when we are having periods, like to some extent, slight pain in the lower abdomen and discomfort in the lower abdomen is very common. But when it is excessive, that you can't, that it hampers your daily activities, you can't go to school, you can't go for work, then it needs to be evaluated.
Okay. So things will be evaluated if it becomes worse, if it persists for a long time. Then it is the right time to see a gynecologist or see a doctor.
Yeah, slight amount of pain is there only for like 90% of the female. It's very common. Yeah, 90% of the females, they experience that pain. So we need not worry. But if the pain is very severe, like the slight pain, it will start with the onset of menses and it will disappear with as the bleeding goes on. But if it is excessive, then it might start prior to menses, like 1 to 2 weeks prior to menses it might start, and it might stay. So that we call it as a secondary dysmenorrhea. So that needs to be evaluated.
All right. Viewers, the numbers are flashed on your television screen. So if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask a question. Dr. Kalpana is with us and she will probably give you all the answers. Now, Doctor, coming back to you again. Now, we are talking about period pain, which is commonly seen in every females or every girl who have gone through menstrual cycle, who is going through menstrual cycle. Now, if we talk about the causes of period pain, now what could be the basic causes of period pain?
You see, it is very difficult to identify the causes. If you ask me causes, it is very difficult.
And it differs from person to person as well?
It differs from person to person. And then, but there are some high risk factors, like certain like girls, they are at risk of having period pain. Now, who are those girls? Like, now suppose someone has a family history, they are more prone. The girls who are having menarche very early, at an early age, like before 11 years of age, they are more prone. Then those who are having, like before the age of 20 years, most of the girls, they tend to have period pain. And people who smoke, nowadays smoking is seen rampantly among young girls. Now, smoking also, it contributes to period pain, they say. And it runs in families also. So there are certain risk factors. But if you ask me the causes, like for primary dysmenorrhea, which I have told you, that means those slight pain, they don't have any specific cause. Like these risk factors are present. One or the other. But the secondary dysmenorrhea, which I have mentioned, that means the intensity of pain is very high.
Pain prior to menstrual cycle?
Yeah, it starts around 2 weeks before. And then it might end, like after the mens goes, like it might still persist. So this type of pain, like there might be some pathological conditions. Now, pathological conditions in the sense, like we call it a premenstrual syndrome, like it is because of the hormonal imbalance in the body, like there are some changes, like mental changes, physical changes. So because of that, the girl might experience pain. So there might be multiple fibroids.
Okay.
Means fibroids means there are small growths in the uterus which can cause pressure effect on the uterine cavity. And so in case of fibroid uterus also there might be some amount of pain. Then there is another very common condition nowadays. That is called endometriosis.
Okay.
So endometriosis is something like, it's a condition where the endometrial tissue, that means the cells from the lining of the uterus, it gets deposited outside the uterus.
Okay.
It grows outside the uterus. And it leads to severe pain, and which is very, very common nowadays. It has got its own complications.
Okay.
In fact, this month is an endometriosis awareness month, and we should be aware of endometriosis.
Absolutely.
And it is a very common cause of period pain. Then again, if there is any infection, it's like we call it pelvic inflammatory disease, which is caused mostly by sexually transmitted bacteria.
Okay.
So, or if we don't follow menstrual hygiene, and so that can be also a cause of period pain. Then lastly, there is another condition which is called adenomyosis. Okay. Adenomyosis is a condition where the cells of the uterine lining, it grows inside the muscles of the uterus.
Okay.
So this is a very severe painful condition. And the patient might bleed heavily also.
Okay.
So these are the causes of secondary dysmenorrhea.
So there are several causes. There are basic causes also, and there are the causes which needs immediate medical attention as well.
Exactly.
Exactly.
Yeah.
And if we talk about the medical attention, the person who needs the medical attention, if the pain persists for a long time,
Exactly.
and it also goes by when your menstrual cycle is over, but still the pain persists.
Yeah.
So you should immediately go and see a gynecologist. And what are the procedures, or what are the first things which you prescribe to the person who have come to you with an immense pain?
Yeah, actually mild pain, you need not see a doctor. But suppose initially your cycles were pain-free, and later on, like you are having severe pain, then you should think of visiting a doctor.
Okay.
Or if the intensity of pain is so severe that you can't tolerate, your daily activities have been hampered, then you should see a doctor.
Okay.
If your pain is associated with heavy bleeding, like you are passing big clots, then also you are supposed to see a doctor.
Okay.
And once and suppose in three consecutive cycles you are having period pain, then you should think of visiting a doctor. Now, once a girl comes with period pain to us, like we first take a careful history.
Okay.
From the history, we try to find out what is the cause, whether it is primary dysmenorrhea or whether it is secondary dysmenorrhea. Then we examine the patient thoroughly.
Okay.
We try to see if there is any infection. We try to see clinically if there is any pathology. And then we take the help of imaging too. Imaging, we do ultrasound. We can do a CT scan.
Okay.
These are the imaging modalities.
Then things will be clear.
Yeah, where we try to diagnose, we try to exclude all the pathological conditions which might cause period pain.
Now, is it something to do with the irregular periods also, doctor?
Yeah.
When you take the history of the
Exactly.
person.
Many a times, many girls, young girls especially, who has period pain, their cycles are irregular. So this is again related to polycystic ovarian disease. Like there is a condition.
Which
this
is
is
also
a
very
condition.
much commonly
It is also very common. And young girls with polycystic ovarian diseases, they tend to have irregular menses or heavy menses, and they have period pain too.
Okay, okay. Now, doctor, as you have already started about this endometriosis, now what are the symptoms of this term?
Yeah. Endometriosis, as I have already spoken, we should be aware that endometriosis, what is endometriosis at least, that all endometriotic cases might not have period pain also, but 90% of the endometriosis cases, they present with severe periods pain.
But it shows some symptoms as well, I guess.
Yeah, symptoms is firstly the period pain, and the pain might be there even without periods also.
Okay.
The girl might experience, the girl or woman might experience severe pain abdomen, like in the lower part of the abdomen, even when she is not having periods. Now what happens is the endometrial cells, the tissue, it goes via retrograde menstruation actually. During menstruation, what happens? The blood comes out of the cervix down through the vagina. But some amount of blood might go retrogradely through the tubes and it might get deposited outside the uterus.
Okay.
So these tissues, what happens every month when the girl bleeds, these tissues also will become thickened. No, these tissues will become thickened, and these tissues also will bleed, and that blood cannot exit from the pelvis. So what happens? It gets trapped in the pelvis, and then it might form cysts, or it might form adhesions between the different pelvic organs. So what mostly we see in case of endometriosis, there is extensive adhesions, and because of the adhesions, the pain is more. And one of the late complications is infertility. And that happens because most of the endometriosis cases we see that the tubes are blocked.
Okay.
The tubes are blocked, and normally what happens after ovulation, the egg traverses through the tubes, and then the sperm ascends into the uterine cavity. After fertilization, the embryo forms, and it gets implanted into the uterine cavity.
Right.
Now, if the tubes are blocked, then definitely pregnancy won't happen. There won't be any fertilization. So, one of the late outcomes of endometriosis is infertility.
Okay,
but I want to assure the people, like endometriotic cases also can plan baby. Yeah, as soon as there are medical treatments, there are surgical treatments also, and with the help of laparoscopy nowadays. Like fertility preserving surgeries are also being done.
But the thing is that one should not avoid things if you think that something or the other is bothering you, or if the pain persists for a long time, you should immediately go and see a gynecologist. Otherwise, things might become worse, and the treatment might be late. So that it's always better to see a doctor at first and then get the prescription, or then get the prescribed things, what to do and what not to do. And it is also very much related with the lifestyle which everybody is leading, doctor, which of course you will be mentioning. Now, if we talk about the complications of endometriosis, doctor, what would be that?
The complications I've already said. Like the first complication is infertility. Infertility means failure to conceive. And because there is the tubes are usually blocked. That is one of the major complications. But we should also know about the causes of infertility. Actually, causes means the retrograde menstruation, and there might be sometimes transformation of the cells.
Okay.
Like transformation of the peritoneal, means the lining of the peritoneal cavity, that those cells can be transformed into endometriotic cells. Or there might be some genetic transformation too. Now there are some risk factors also for endometriosis. Now risk factors are like, as I have already mentioned, like smoking is a risk factor. Then the genetic, like if anyone has a family history. Lifestyle also matters.
Then so everything is actually linked.
Definitely.
Okay, doctor, will come to more discussions, but now we have to take a break. All right, viewers, will slip into a short break, but do come back soon because we have lots more on the other side.
Okay.
Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the menstrual cycle pain and what other things can be done. And we are talking also about the life cycle, what we are leading. And Dr. Kalpana is with us, giving you all the answers. Now, doctor, coming back to you again. Now, we were having an idea about the basic, what is the reason behind period pain and what can be done. Now, if we talk about the home treatment for period pain, there might be some.
Yeah, there are some home remedies actually, and people keep on asking. First of all, we can give a hot massage down.
Okay.
Yeah, like a hot heating pad we can give, or we can massage lower abdomen. And then we should try to avoid certain foods, like smoking causes more pain, we should know. So we should try to avoid smoking. And then there are some painkillers, like the analgesic. Yeah, we can take the help of analgesics, no harm. We can always take the, regular activities, regular exercise has to be carried out. In fact, relaxing yoga is a very good practice. Like relaxing, there are some relaxing yoga steps like which we should follow. And if we lie down and lift our legs, Like that is a very good posture.
Okay.
And bend our knees, and that is also another good posture. If we lie down sideways and flex our knees, that is also very good posture. So these are the home remedies actually, and certain diets we should take nutritious food, definitely. Food rich in vitamins and food rich in minerals, like calcium is very important. Iron is very important during during periods.
Okay.
And we should take plenty of juices, vitamin C. These are important. Like the nutrition is very important. Nutrition plays a very important role. Exercise is very important.
Okay.
And these are basically the home remedies actually.
Okay. What we see is that few girls or few females, they face a lot of like a lack of appetite during periods, and they don't feel like eating everything or everyone. So on that note, what would you like to suggest, doctor, on the dietary part, and also about the foods which need to be avoided and can be included during those periods? We have seen that some females, they eat a lot of chocolates.
Yeah, exactly. Yeah, definitely. In fact, that is a very good concept. Like dark chocolate, they say it's very good for period pain because it contains magnesium. And magnesium causes relaxation of the uterine muscles.
Okay.
So dark chocolates, very good for period pain. You can always advise. And but studies have proved that dairy products are not good.
Dairy products.
Dairy products like cheese and other dairy products, they should be avoided. And smoking should be avoided, alcohol should be avoided. And nutritious food, like food rich in vitamins, multivitamins, food rich in calcium, food rich in iron. These are the food which you need to advise during period, which contributes to some extent to relax the uterus and to decrease the period pain. But one very important thing which we should remember is menstrual hygiene.
Hygiene is very important.
Yeah, menstrual hygiene we should always try to follow. We should at least, because young girls, they are, if we ask them after how many hours do you change your sanitary napkins, some say 7 hours, some say 8 hours. And when we tell them, no, you are supposed to change every 3 to 4 hours, then they'll say, no, we just bleed 1 drop. We just bleed little only. So why to change? But you should remember, blood is a very good culture media for bacteria. So even a drop of blood, if it stays for more than 4 hours, 5-6 hours, bacteria will grow in the sanitary napkins, and then it will cause ascending infection in the reproductive tract. So that is the reason we should follow menstrual hygiene. Absolutely.
Okay, so it's very important to have a proper menstrual hygiene as well. Now, talking about the girls, school girls especially. Now, there are also awareness campaigns held in schools, like hospitals take up, or the school authorities take up. Now, on that note, like for the campaigns which is being organized, what do you think, doctor? Like, do schools have to have a proper campaigns and a lot of campaigns for the school-going girls as well, and also about the college-going girls?
Absolutely, yeah. It's in fact, we have a society like Gynecological Society of Guwahati, GOGS. And through the society, plus there are multiple NGOs also in, like especially in Guwahati, like who are stressing on menstrual hygiene these days. So I myself, I'm associated with an association like NGO also, and through GOGS also. Like we distribute sanitary napkins in various institutions. We have donated sanitary napkin dispensers also, and then we try to educate the children, especially to get rid of the myths. We make everyone aware of the myths which are surrounding menstruation, and we also educate them regarding menstrual hygiene, because in the long run, like poor menstrual hygiene has a big role to play if we think about infertility, if we think about endometriosis. In fact, the overall morbidity of the female health increases. So it is very important to spread health education regarding menstrual hygiene in schools, in institutions, and in fact in the society.
Now talking about, we have to also touch upon the rural sectors as well, rural areas as well, regarding the awareness part, because there are a lot of people who are debarred by these things. And if we talk about the use of sanitary napkins as well, how important is to reach out to the rural people and aware them about the menstrual hygiene, doctor?
Yeah, it's very important, because the infection is much higher in rural areas. So we do that too. We do visit rural areas also, and we try to educate the people. Now those who cannot afford sanitary napkins, they can always use clothes, no problem. But it is important to know that they have to change the clothes every 4 hourly or every 5 hourly. The way they are washing, the way they are drying the cloth is very important, and what material they are using is very important. They have to, like, it's always better for them to use cotton cloths, cotton clothes, and how to change, while changing also how to like wash their hands and change, that is very important. And especially when you are talking about rural areas, they need to concentrate on the diet too, like for poor menstrual hygiene cases also, they need to follow good hygiene, and they need to follow a good nutritious diet too. So in fact, the lifestyle is very important.
Very important. Now doctor, do you also suggest some supplements to be taken during menstrual cycle if a person needs some kind of like vitamins? Calciums, iron is very important during.
Iron is very, I have already mentioned, iron is very important, because even though blood loss is minimal, like we see that many young girls, they are having irregular bleeding, they are having heavy bleeding, so they need to replenish their iron by taking supplements. They need to take calcium too, and like, in fact, the minerals they need to take in a proper amount, and so the food should be nutritious, healthy.
Food should be nutritious.
They should concentrate,
Okay, doctor, if we want to know about the cycle, the number of days a female or a girl is going for her periods, like if suppose we see that few girls, they just have for 3 days of periods or 4 days, which is the proper time, or like do someone has to worry that I just had periods for 3 days and I need to see a doctor immediately. So when is the right time to see a doctor, and when is the time you don't have to worry?
This is a good question, in fact, because many young girls, they are really tensed up, and they used to come to us saying, my blood flow is very less, but I am getting regular periods. Now we need not worry, like it depends, it varies from girls to girls, actually, person to person. And normal flow is around 5 to 7 days. Like it's like heavy bleeding is there first 2 days, then it tapers. But there are like girls who bleed only 2 days in a month, like 2 days in a month, and they have regular periods with normal physiology, normal findings. So we need not worry at all. But if you don't menstruate at least minimum 4 times in a year or 5 times in a year, then you definitely need to see a doctor. Minimum 4 to 5 times in a year you should menstruate.
It's not only that if suppose 2 months goes with the same flow, and the 3rd month you are always you are all normal with it, so you don't have to worry and have to see a doctor.
Nothing to worry, because it depends, it varies, I told you, with stress. If you are more stressed during exam time, you'll have little irregularity in menstruation. As long as your diet is okay, as long as you are healthy, you need not worry, and your periods are going on. Like, but if you're having heavy bleeding, if you're passing clots, if the bleeding goes on for more than 7 days, then you definitely need to see a doctor.
Now, doctor, we have seen that technologies have advanced nowadays, and if one goes for a proper treatment, a proper test is being done, diagnosis part is being done. So if any patient comes to you, we see that technology is being advanced. So what assurance as doctors you give to the patients that things will be okay? And because there are a lot of questions in their mind, confusions in their mind, what will happen or not. So what is the first thing? What if we talk about the diagnosis part? What would you like to tell on that?
Firstly, because they are, especially the parents are very apprehensive, the mothers, when their daughters get menarche, like immediately after menarche, their bleeding, it's seen that they are having irregular bleeding or heavy bleeding, or they are having pain. So the mothers used to be very tensed up, and they used to come to us. So what we tell them is, first of all, it is absolutely normal. The period pain, if she can tolerate, nothing to worry. And if the way I told you before only, like if it is persisting, if it is very severe that she cannot do her normal activities, absolutely. Then when they are coming to us, nowadays we have all the modalities of diagnosis, like a good ultrasound will tell us anything, like only a good ultrasound is sufficient to diagnose. A good history, good clinical examination, and an ultrasound is sufficient to say if there is any pathology in her uterus or in her ovaries. And if there is any pathology also, nowadays we are having best of the best way of surgeries also, best of the best way of hormonal tablets also. So nothing to worry at all.
And when we talk about gynecology, then there is a lot of hesitancy also seen among girls and also among the other young girls as well. So on that note, what would you like to tell them, doctor, who are watching our show? There is a lot of hesitancy.
Hesitancy, definitely, yeah. We should, that's what I was saying, that we should not be shy of menstruation. Menstruation is nothing to be shy of. Like, we should be very open. In fact, I would like to suggest, nowadays in the media also, they are advertising the sanitary napkins. People are talking openly. So we should get rid of the myths. And in fact, before, like in olden days, they used to say during menstruation you are supposed to stay in a room, not to work. But nowadays, with the advanced technology, like there are very good best of the best sanitary napkins, tampons.
People are coming up,
the menstrual cups, and it's like the topic has been discussed freely everywhere. So now there are marathon runners during menstruation. We get swimmers during menstruation. So people, the rate of school skipping is coming down during menstruation. So we need not worry. The pain, 90% of the pain is normal pain, period pain, and even if you are having a pathology also, once you come up, we definitely will give a solution. But people like young girls, they should not think that it is normal and I'm feeling shy, I won't go. That pain is also very severe. Or if you have any problem,
you won't see a gynecologist and just speak up your problem.
Exactly. That is wrong. So whenever you need to come to a gynecologist, you should come, and we are there to help you.
All right. Thank you so much, Doctor, for this lovely advice at this point in time. I'm sure the viewers who have watched our show must be benefited with the answer just Doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.
Goodbye. Thank you.